You're all ready to go.
Okay. Well, I just want to wish everybody a happy afternoon and a safe afternoon. My name is Michael Barrett, and I work for the Bud Group. And our conversation today is try to provide a platform for anybody who has questions about safe and a healthy environment to reopen schools. And we have with us today, Dr. Salah Qutaishat, who is kind of I've gotten a chance to know him over the last 8 or 9 years. Just an incredible resource and a very noted infection preventionist and epidemiologist. And so we're going to do a short intro and then any questions that you have. And then we'll go over some of the services that the Bud Group offers to the membership here. We've been in business for a while. We don't want to make this an advertisement. We want to make it a conversation. And let me just go through here. Again, Michael Barrett, I'm in charge of sales at the Bud Group for specialty services. So that falls under the umbrella of enhanced cleaning. We do a lot of different services in that area. As a traditional building service contractor, we do janitorial services, landscaping, and many other different services that we can be a project manager for all different types of sectors. And then we want to talk about how we can partner with you or just be a resource to answer your questions and offer solutions. Also on the call, Jason Lee is he's the head of program management for specialty services, valuable resource. Mark Thompson, he's from our education division in terms of putting together comprehensive programs for energy, cleaning, landscaping, all of these type of areas that can help your overall organization have a plan. And also joining on the call is some of the Bud Group employees. That's kind of a map of North Carolina where we have actual physical branches of support. We've been in business for almost 60 years. We're headquartered in Winston-Salem and have over 5,000 employees, and we're in 11 states. So the topic for today, and again, use chat or whatever. If you have questions or want a clarification or anything, please utilize the system. So it's my pleasure. Without further ado, Dr. Salah Qutaishat is an infectious disease epidemiologist. I've known him for 8 or 9 years. Very top organizations that he's worked with: Munson Healthcare, Diversity, Premier Healthcare. And he's going to go over the following points there. And then we'll go over some of the ways that we can help partner with you to achieve these goals. And if you have any questions of us or Dr. Salah, please use the chat platform. Dr. Salah?
Thank you, Mike, and thank you, everybody. And I hope I'm not gonna most probably, and this is what I say all the time, people know more about this than I do because we're all living it. So if there's any question, please interrupt. And I'm not going to spend a lot of time lecturing, although I love to lecture, but that's not the purpose of this presentation. But what's happening is that, and I'm a data geek, and I have to admit that, so I almost memorized the numbers. Last week, for example, we had more than 900,000 cases in the US. So, and more than 80% of them are from this Delta variant. So what is going on with this virus? Viruses are very simple structures, and how can they really do this? And it's not them, it's us. We provide them with a mechanism to multiply, and then when they're multiplying, they make errors. And those errors are called, they're mutations in their basic genetic structures that lead to changes in the structure of what you all now know, the spike protein, which is on the surface of this virus. And that's the one that is causing a lot of harm to us. And that's the one that we developed vaccines for. And those minor changes become predominant because it suits the virus better spreading through the population. So the virus, its goal is not to really kill us, its goal is to sustain itself. And we went through several mutations thus far, and if you remember, early we used to call them by country, and now we gave them that Greek number. So this mutation started in India, and if you recall, a couple of months ago, India was going through a huge surge, which, for the population of India, we really didn't see a lot of infections until recently. So the virus is picking and choosing where to go and what to do. Finally, it made it to the US, and what it takes is one. And then now we have more than 80% of the cases in the US are this Delta variant. What's really interesting about the Delta variant, and I'm gonna just end with a science, is it's highly infectious. It's twice as transmissible. The word transmissible is really, it spreads better than the original virus. And it's actually picking a completely different population. If you recall that the first wave hit the elderly, and we almost felt that it's like, oh, most of us are immune and most of you are immune. But then now we're seeing more in a population that is younger, but that's for two reasons. Number one is the virus is actually more effective in that population. Also, the effect of the vaccine, how it protected a different, that population that is vaccinated. And this virus is spreading effectively in the unvaccinated, but it's still spreading in the vaccinated. Now, if what is it that we can do differently now with this virus? I think most of what we've done is effective, but we are challenged, especially most of you are challenged with the population that we're serving now because of the infectiousness in this population. And the key, mechanisms of spread, we struggled earlier in the pandemic. We said, I remember the days where you couldn't find vinegar, bleach, any disinfectant in addition to toilet paper, anywhere in a supermarket or suppliers couldn't provide enough. Then the science came and said, it's not really as important. The truth is nothing changed. It's not as important. It's maybe other mechanisms are more effective in the transmission. And really what we've learned, and not from this virus, we learned from SARS-CoV-1, which is the SARS of 2003. Many of you may remember this, that air continues to be a vehicle to sustain the virus and move it from one person to another, knowing that it's a respiratory virus. And I think it's important for us to remember that mechanism of having particles that contain the virus, although the virus doesn't live that long in the air, neither in the air on surfaces, but it allows it that vehicle to find the next victim. And I'm going to stop here, Mike, and see if you have anything to add or if there are any questions.
Didn't see anything on chat, Salah. what do you feel, and again, I don't mean to steal your thunder, a lot of different questions, how quickly this came back. I think a lot of the big, whether you want to call it political, is the masking issue that administrators have to deal with at this time.
It's, I think I'm going to reveal something that most of us who worked in healthcare, that were, the majority of us are biased. So I'm going to reveal my bias. And my bias actually is for the science. And most of the time when we get asked those questions, we say, in hospitals, we use masks, and there are different ways and reasons why we use masks. Number one, in the OR, we actually monitor surgeons and any OR staff when they enter the surgical suite, i.e., when there's a patient in that room, we make sure that they're all masked. And the main reason why we do this is we want to protect the patient. And we also understand that it gets, there's humidity and it gets hot in that room, and some of those surgeries last for a long period of time. We also know that many of them, by the minute they open the door and leave that surgical suite, the mask is off because of the heat. So we do this to protect the patients from us. Going back to the 80s, when TB researched in the US, we discovered that the only way to protect our healthcare workers is for them not only to wear special masks and ventilators. Now it's popular, the N95, a high efficiency respirator. It's to protect them from TB. We also introduced ventilation processes in the rooms where patients with TB or suspected TB are placed. And we expanded that to other infectious diseases. So masks have two purposes: one, to protect the person that is wearing the mask, and the other one is to protect others within that environment. I actually, because I was trained and I worked in healthcare for many, many years, to me, masking was a logical process of, let's make sure that I'm reducing my risk. And I wore the surgical mask, I wore the N95 mask based on the prevalence of this disease in my community to protect me and protect others from me. So when you look at the campaigns against the masks, and I'm also becoming more of an expert in information that is questionable, you're gonna find some shades of anti-vaccine. The anti-vaccine movement is, is not new to us. So there's a logical marriage between the anti-vaccine movement and the anti-mask movement. So COVID-19 became the poster child for the anti-vaccine movement. And they added the anti-mask to it because it's just an opportunity for them to enhance their ideology amongst the population that is scared, and there's a lot of fear out there. I'll stop here because that's my personal opinion and my practice. And when people ask me, what do you recommend? Put a mask on and get vaccinated.
You talked a little bit about the evolution. I mean, mentioned SARS.
Yeah.
I wonder how many people, professionals here, education professionals, even had hand hygiene programs 15, 20 years ago. Now that's incorporated in everybody's daily lives. And, with things through the last 10 years, again, SARS again, but Ebola and some of the other things that have come up, now people know for proper disinfection, the dwell time and the right approved chemicals to use as well. So if you want to continue on, if anybody else has questions, I don't see anything on chat right now, but let us know. And then maybe I'm interested in learning about the air purification as well, Dr. Salah.
Yeah. So, I worked for diversity for, I don't know how many years, 4 or 5 years. And I learned a lot about cleaning and disinfection. But most importantly, I did research in hospital settings. And of course, I worked in healthcare for many, many, many years. I don't want to count the number of years in different settings. What we learned is that infectious agents do use two vehicles, and I have my favorite slide, and I gave a talk at the national conference a couple of months ago. The two vehicles for transmission of, the main two vehicles, transmission of infectious agents in a hospital setting are surfaces and hands. And surfaces and hands, research showed that the hands of a healthcare worker usually mimic the skin of the patient. And also they're almost a carbon copy of environmental surfaces. So what I'm trying to say here is that there's an intertwined and intimate relationship between the skin of the patient, or the patient and their flora of organisms, hands of healthcare workers, and surfaces. Now, what we do when we perform surgeries on patients, we actually do our best to reduce the flora on their skin to prevent surgical site infections. And I'm not sure how many people know that, and I don't know if anybody cares about that. So that's the skin of the patient. Then hand hygiene and surface or environmental hygiene, I call it, they're two pieces of another layer of making sure that whatever pathogens are present in that environment, the microenvironment in the patient room, is removed. The microorganisms are removed and reduced, so the risk of transmission to the healthcare worker and to other patients is eliminated by cleaning and disinfection of surfaces and hand hygiene. We actually reduce the opportunity of transmission from patient to patient or from patient to healthcare worker. Now, for specific pathogens and SARS-CoV-1, CoV-2, chickenpox, TB, those pathogens have the ability also to use air, and by being present in the air, to actually move from one patient to another through the respiratory, or from a patient to healthcare worker through the respiratory tract. And when we dealt with those patients, we put them in a what's called a negative pressure air rooms, specific rooms. So the air did not circulate with other rooms in the hospital to ensure that there's less pathogens in the air, and it's not going to other rooms or to the general air circulation. We also, this is something that everybody knows, we maintained in the absence of the negative pressure room. We had devices in those rooms to ensure that the air was filtered, the term filtered, it's HEPA filtration of the air to make sure that certain size particles are removed before they are recirculated in that room. Does that answer the question?
Yes, I believe so. So getting back where educators have just so many different areas to be focused on, high touch points, cafeteria, offices, classrooms, buses, gyms, multi-purpose rooms. We call it enhanced cleaning. what is the importance of that, and then the processes to achieve those excellent results that we need.
So, so there's something really interesting, and there's a lot of research that comes from the Cleveland, Ohio VA. And this is not, some of it is new, but most of this research is older research that looked at cleaning and this. I think that the norm in healthcare, and I talk about healthcare a lot because that's my world. The norm was you clean once a day, and then when the patient is discharged, you do what we called terminal cleaning before you bring a new patient into that room. What that research looked at is increasing the frequency of cleaning and disinfection of the room, and looking at the impact of that frequency on the presence of pathogens on surfaces. And I think, you know, I don't have to convince you that that worked better, because for anybody to, I use this example kind of, it's silly. If you clean the surface now, what makes you think that 6 hours from now, that surface is not contaminated, especially in a patient room where there's high activity? So we knew that, but we needed the research and the science to support that the frequency is important, i.e. cleaning, better cleaning of that room. And I'm not going to use any other description, but many hospitals went above and beyond to ensure that there's minimal transmission of infectious agents to patients and staff.
Okay. All right. And let me move on in our presentation here, Dr. Salah. Anybody just shout out questions or use the chat platform if you have anything there. I'm going to move forward, Dr. Salah. So how important is it for any organization to have basically a campus or building assessment, and then a plan for communications for the staff, the students, the parents, and administration, you know, in a charter school environment where they're basically an independent organization? So on here, we have the different areas that need to be addressed: enhanced cleaning, restrooms, high touch points, how to monitor your indoor air quality, hand hygiene program, and then making sure you have supplies on hand. And then communications, we can set up signs, flyers, email programs. We can make those accessible to your organization. In our return to school strategy, we have a customized program and scope of work to make sure we're actually doing traditional cleaning, but also providing disinfection systems using hospital grade and approved products, equipment. A new thing that's relatively new, we have an excellent program with Protex. It's an antimicrobial barrier protection that can provide efficacy for up to 90 days. We have HEPA filtration systems that help reduce odors, and air quality monitoring and site assessments as well. But one thing we always want to make sure is the door-to-door safety protocols, not just classrooms and cafeteria and offices, but bus transportation and, you know, activities, multi-purpose rooms, gyms, things of that nature. Jason Lee, we have a lot of people in our organization are LEED certified. Basically does this cutaway. Jason, are you available to talk on this point?
Yeah, I sure am, Michael. Hope you're doing well, everybody, today. I just want to take a few minutes, talk a little bit about Bud Group and some of our additional abilities that Dr. Salah touched on around disinfection and obviously ensuring a healthy environment there for your students, staff, and faculty. So some of the other services that we can provide as a partner to you, your facility, as you can see, a lot of different things, both inside and outside. We call it a 360 facility solution. As Michael mentioned, I'm LEED certified. So if you have any type of LEED criteria that you're following or well building certification that your standards that you're following there, we can also follow those as well. You notice indoor air quality. I'll really touch on that just real quick. I think that's really critical right now as we learn more and more from COVID over to the Delta variant. As we learn, it is an airborne disease that is transmitted that way through cross transmission. We also have several different solutions based on your specific facility that can purify air quality at a very low cost compared to some other solutions that you may hear about out in the marketplace. We also have air monitoring systems to identify, and the reason I bring that up, it's to identify any type of issues before it really becomes a problem. So I'll give you an example. One of the systems was in place at a night school over the summer, and a spike was recognized for the air quality at the time. They alerted the teacher and went over to that classroom, around 35 students, found out one of the students was not feeling well, so they dismissed class. That student went home, ended up testing positive. I don't know if it was COVID or Delta variant at the time, but the real benefit of that story is no other persons were infected. So if this system were not in place, it is quite possible that all 35 students, along with the faculty and anybody else that person would have come in contact with, it could have been much worse. So this is some of the proactive things that we have in place. In addition to enhancing your facility, we certainly want to be your provider to help make sure that your students, staff, and faculty are safe. So Michael, that's what I have on this end. Thank you again for everybody as far as all your input. Please let us know if we can help you in any way, and look forward to the opportunity to partner.
Yeah. Thank you, Jason. So questions and solutions, if you have any questions, please send it to us. One thing I did want to share as well, that's my contact information, or you can send it to Wendy or Catherine. But some of the other areas that we can help in terms of reducing the spread of coronavirus is remediation. So we do have the capabilities to come in and spray, mist, disinfectants. We have a CDC compliant program for all areas of your facility. We call it enhanced cleaning or deep cleaning, all areas. The gyms, the bathrooms, classrooms, anything you need. We can put technicians on a route basis, either before, during, or after hours. And then again, the transportation vehicles, buses and vans, I think are always something that we have to keep in mind. And these are areas we can provide a scope of work for you. Communications, emails, signs, being able to give the staff and administration tips and just to alleviate the stress and the routines and the restrictions, and making sure that the students and the parents realize you're developing healthy habits and a advanced hygiene program for the campus. One area we've had a lot of interest and success with is our air purification system. It's called Airbox. And this is a filtration system. It comes in 3 sizes. It helps produce, we believe, by the productivity of the workforce, you feel like you're in a better environment for the air. It helps reduce the spread of coronavirus. And if you've got a healthy workforce, it's going to minimize the sick days and your productivity. It's a simple operation, easy filter changes. We can use through a charcoal system, HEPA filters. There's 3 sizes. And what this does, it provides an odor shield, an antimicrobial filter, and also a purifying HEPA filter. There's 3 different sizes, as I said before. It all depends on the head count and square footage of your room or office or the area that you want to protect. I want to go back to this real quick. we actually have a order that we're processing right now for one of the colleges. We did a test trial program. They saw the improvement in the air quality and actually the odors in one of the areas. And they're using the CARE funds to help provide one of these for every classroom on their campus. And it is basically like a humidifier. It's a simple plug-in. There's no hard wiring, and it's almost immediate. And you can use monitors to track and download and be able to provide data on these systems. We also have UV technology, the Moonbeam, and that provides 3 minutes kill time for most pathogens. It's non-toxic. It's just a UVC light. Non-toxic, very cost effective. I've seen a lot of people use this for classrooms where there might have been a case or areas that you just want to make sure routinely are taken care of. Again, I'm giving you back a little bit of your time. And just if you have any questions, please send it to us now if you have it. And I believe that Wendy and Catherine will be posting this to the website.
Yes, the video will already be live on our Facebook page as well as being recorded. And then we will post it to our YouTube channel and our website. And thank you so much. That was really interesting.
Thank you very much. We appreciate it, Catherine. Thanks for setting it up and letting us be a participant, okay?
Yes, and thank you for being a resource.
Thank you.
Thank you.